Question number 1. Pharmacokinetics is. The right answer is option B. The study of absorption, distribution, metabolism and excretion of drugs. Question number 2. What does pharmacokinetics include? The right answer is option D. Distribution of drugs in the organism. Question number 3. The main mechanism of most drugs absorption in gastrointestinal tract is. The right answer is option D. Passive diffusion. Question number 4. What does the term bioavailability mean? The right answer is option C. Fraction of an uncharged drug reaching the systemic circulation following any route administration. Question number 5. Pick out the appropriate elementary route of administration when passage of drugs through liver is minimized. The right answer is option C. Rectal. Question number 6. Which route of drug administration is most likely to lead to the first pause effect? The right answer is option B. Oral. Question number 7. What is the characteristic of the oral route? The right answer is option B. Absorption depends on gastrointestinal tract secretion and motor function. Question number 8. Take the features of the sublingual route. The right answer is option A. Pretty fast absorption. Question number 9. Pick out the parenteral route of medicinal agent administration. The right answer is option D. Inhalation. Question number 10. Parenteral administration. The right answer is option C. Usually produces a more rapid response than oral administration. Question number 11. What is the characteristic of the intramuscular route of drug administration? The right answer is option B. IV solutions can be injected. Question number 12. Intravenous injections are more suitable for IV solutions. The right answer is option B. False. Question number 13. Biotransformation of the drugs is to render them. The right answer is option D. Less lipid soluble. Question number 14. Metabolic transformation is. The right answer is option B. Transformation of substances due to oxidation, reduction or hydrolysis. Question number 15. Half-life is the time required to. The right answer is option A. Change the amount of a drug in plasma by half during elimination. Question number 16. Pharmacodynamics involves the study of following except. The right answer is option B. Absorption and distribution of drugs. Question number 17. Pharmacodynamics involves the study of following. The right answer is option A. Mechanisms of drug action. Question number 18. What does affinity mean? The right answer is option B. A measure of how tightly a drug binds to a receptor. Question number 19. Target proteins which a drug molecule binds are. The right answer is option D, all of the above. Question number 20. An agonist is a substance that. The right answer is option B, interacts with the receptor and initiates changes in cell function, producing various effects. Question number 21. An antagonist is a substance that. The right answer is option D, binds to the receptors without directly altering their functions. Question number 22. Idiosyncratic reaction of a drug is. The right answer is option C, unpredictable, inherent, qualitatively abnormal reaction to a drug. Question number 23. What phenomena can occur in case of using combination of drugs? The right answer is option D, synergism. Question number 24. Tachyphylaxis is. The right answer is option B, very rapidly developing tolerance. Question number 25. Which effect may lead to toxic reactions when a drug is taken continuously or repeatedly? The right answer is option B, cumulative effect. Question number 26. Which of the following is not a pharmacokinetics process? The right answer is option D, side effects. Question number 27. Pharmacodynamics consider. The right answer is option A, the way drugs bring about their therapeutic effects. Question number 28. The liver is the major organ for. The right answer is option B, metabolism. Question number 29. Most drugs and metabolites are excreted by. The right answer is option A, the kidneys. Question number 30. Which of the following routes of drug administration is most convenient and would not require skilled healthcare supervision? The right answer is option A, PO, oral. Question number 31. The following are parenteral products except. The right answer is option D, topical patches. Question number 32. A name is assigned to a drug when it first arrives on the market. The right answer is option C, generic name. Question number 33. The route of drug administration where small amount of medication is injected just beneath epidermis. The right answer is option A, intradermal. Question number 34. The component of a cell that accepts and interacts with a drug molecule is called. The right answer is option D, receptor. Question number 35. An antagonist is a drug that has. The right answer is option D, affinity but not intrinsic activity. Question number 36. The length of time required for a drug to decrease concentration in the plasma by 1/2. The right answer is option A, half-life. Question number 37. Each drug has a pregnancy classification attached to it. A drug labeled amines. The right answer is option C. No adverse effects have been observed in animals, no human studies. Question number 38. Which of the following drug targets involves inhibitors false substrates in a prodrug type? The right answer is option C, enzymes. Question number 39. What is the correct order of bond strengths from strongest to weakest? The right answer is option D. Covalent is stronger than ionic, and ionic is stronger than hydrogen, and hydrogen is stronger than van der Waals forces. Question number 40. A competitive antagonist affects the agonist and a non-competitive antagonist affects the agonist. The right answer is option A, potency, efficacy. Question number 41. For most drugs, a frequency distribution of the response plotted against the log of the dose produces what kind of curve? The right answer is option E, Poisson distribution. Question number 42. Receptors are usually. The right answer is option B, proteins. Question number 43. An example of a receptor which is a structural protein. The right answer is option C, tubulin. Question number 44. Factors that may cause variation in drug responsiveness. The right answer is option E, all of the above. Question number 45. Which of the following refers to an increased intensity of response to a drug? The right answer is option C, hyperreactive. Question number 46. Which of the following is the most relevant use of therapeutic index? The right answer is option A, guide for toxicity in therapeutic the setting. Question number 47. Which of the following is the median effective dose or the dose at which 50% of the individuals exhibit the specified quantal response? The right answer is option B, ED50. Question number 48. Intrinsic activity is a drug's ability to elicit. The right answer is option C, response. Question number 49. Which direction would a partial agonist shift the dose response curve when compared to a full agonist? The right answer is option E, to the right and possibly down. Question number 50. Which of the following is considered the therapeutic index or ratio? The right answer is option E, A and B both. Question number 51. Concerning drug receptor interactions, the constant Kd refers to. The right answer is option C, the drug concentration required to occupy 50% of receptors.